Hello, and welcome to AI Medical School. In this video we are going to talk about thrombosis and embolism. But before we start, if you didn't subscribe to my channel, so please subscribe to it and like the video. So let's start. Thrombosis. Thrombosis is the formation of a blood clot inside the blood vessel, obstructing the flow of blood through the circulatory system. When a blood vessel is injured, the body uses platelets and fibrin to form a blood clot to prevent blood loss. Even when a blood vessel is not injured, blood clots may form in the body under certain conditions. Thrombosis may occur in veins or in arteries. Venous thrombosis leads to congestion of the affected part of the body, while arterial thrombosis affects the blood supply and leads to damage of the tissue supplied by that artery. Embolism. An embolism is the lodging of an embolus, a blockage-causing piece of material, inside a blood vessel. The embolus may be a blood clot, a fat globule, a bubble of air or other gas or foreign material. An embolism can cause a partial or total blockage of blood flow in the affected vessel. Such a blockage may affect a part of the body distant from the origin of the embolus. An embolism in which the embolus is a piece of thrombus is called a thromboembolism. Thromboembolic events. Activation of the coagulation system. Solid mass of blood constituents formed within the vasculature. Thrombosis. Formation of a blood clot at the site of coagulation system activation. Embolism. Migration through the vasculature to a distant site. Cause tissue damage by occlusion of blood vessels. Result in ischemia and infarction. Thromboembolic events. Ischemia. Lack of oxygen due to the impaired blood supply. Results in reversible cell injury or irreversible injury and necrosis. Depends on duration and tissue's metabolic needs. Infarction. Tissue necrosis due to ischemia. Major causes of morbidity and mortality. Myocardial infarction, stroke, pulmonary embolism. Normal hemostasis. Maintains blood in a fluid state in normal vessels. Induces rapid, localized plug at the site of vascular injury. The complex set of activators and inhibitors. 3 components: endothelium and vascular wall, platelets, proteins of coagulation and fibrinolytic cascades. Arterial vasoconstriction, primary hemostasis, temporary platelet plug, platelet adhesion, platelet activation, platelet aggregation, secondary hemostasis, solid permanent plug, activation of the coagulation cascade, conversion of fibrinogen to insoluble fibrin, aggregates of polymerized fibrin and platelets. Counter-regulatory mechanisms restrict plug to the site of injury. Hemostatic mechanisms. Number 1. Arterial vasoconstriction. Exposure of subendothelial nerve fibers, reflex. Endothelial damage registered endothelin secretion. Primary hemostasis. Von Willebrand factor binds to exposed collagen. Platelets bind to VWF. Platelets activated on contact and release granule contents, including andorin pisators and thromboxane. Platelet aggregation stimulated by andorin pisators and TXA2 cascade of PLT adhesion, activation, and aggregation. Hemostatic mechanisms. Number 2. Secondary hemostasis. Tissue factor released from damaged endothelium. Tissue factor and secreted PLT factors activate the coagulation cascade. Activation of thrombin. Conversion of fibrinogen to insoluble fibrin to fibrin deposition. Autocatalytic activation of the coagulation cascade. Binding to PLT surface receptors, further PLT aggregation and activation. Fibrin deposition stabilizes and anchors aggregated PLTs. Hemostatic mechanisms. Number 3. Counter-regulatory mechanisms. Fibrinolytic pathway, plasminogen activation to the formation of plasmin. Coagulation cascade. circulating urokinase-like plasminogen activator, UPAR, release of tissue-type plasminogen activator, TPAR, from endothelium, anticoagulant pathways, heparin-like molecules on the endothelial surface to antithrombin 3 activations, endothelial synthesis of protein S thrombin to thrombomodulin activation to protein C activation. Thrombosis, inappropriate activation of hemostatic mechanisms, such as uninjured vessel or very minor injury. Definition: formation of a solid mass of blood constituents within the vascular system in life. Virchow's triad: changes in the vessel wall, changes in blood flow, changes in the blood constituents. Changes in the vessel wall, primarily damage to intimal surface causes of endothelial cell injury, ulcerated atherosclerotic plaques, scarred valves in endocarditis or prosthetic valves, radiation, cigarette smoke, cholesterol or lipids, results of endothelial cell injury, exposed subendothelial extracellular matrix, platelet activation, activation of the coagulation cascade, depletion of antiplatelet, anticoagulant and fibrinolytic functions, endothelial activation to activation of procoagulant functions. Changes in blood flow. Normal flow is laminar. Cells in the center of the bloodstream, a clear zone of plasma adjacent to the endothelium. Disrupted flow is static or turbulent. Stasis. Platelets in contact with the endothelium. Prevent dilution of clotting factors. Retard inflow of clotting factor inhibitors, such as myocardial infarct, aneurysm, atrial fibrillation, hyperviscosity syndromes. Turbulence. Eddy currents with local pockets of stasis. Promote endothelial cell injury. For example, ulcerated atherosclerotic plaque. Changes in blood constituents. Hypercoagulability. This leads to recurrent venous thrombosis, arterial thrombosis, recurrent abortion and stillbirths. Inherited or acquired oral contraceptive use. Pregnancy or hyperestrogenic states. Malignancy. Elaboration of a procoagulant factor, leading to arterial and venous thrombosis. Tissue damage. Surgery, trauma, burns. Hyperviscosity. Predisposes to stasis in small vessels, polycythemia or deformed RBCs, sickle cell anemia. Presence of endothelial cell toxins. Toxins in cigarette smoke, high levels of lipid or cholesterol. Predisposed to endothelial cell injury. Thrombus formation. Atherosclerotic plaque. Initial fatty streak. Plaque enlarges, smoking or hyperlipidemia. Turbulence, due to protrusion into the lumen. Loss of endothelium and exposure of collagen. Platelet adherence and activation. Fibrin meshwork deposition with RBC entrapment. More turbulence, more platelet adherence, more fibrin deposition. Thrombus of alternating layers of platelets, fibrin and red blood cells. Arterial thrombi. Large vessels, like aorta, heart. Non-occlusive or mural smaller vessels, like coronary arteries, leg arteries. Often occlusive, classically have alternating white and red layers called lines of Zahn. Alternating layers of pale platelets and darker RBCs, such as aneurysmal sacs, infected left ventricle, damaged heart valves, atherosclerotic plaques. Consequences: ischemia in tissues distal to thrombus with possible necrosis. May embolize due to rapid flow. Venous thrombi. Sites of stasis, commonly veins of lower extremity red. More enmeshed erythrocytes, less platelets. Occlusive. Predisposing factors. Bed rest, immobilization, heart failure, surgery, trauma, pregnancy, hypercoagulable states. Consequences: rarely cause ischemia if affect arterial supply. More commonly embolize. Fate of thrombi. Dissolution. By fibrinolysis. Propagation. Along the length of vessel to complete vessel occlusion. Embolization. Recanalization. Capillaries invade the thrombus to re-establish blood flow. Organization. Inflammation and fibrosis. Registered replacement by scar may obliterate vessel lumen. Recent thrombi may be completely dissolved. Older thrombi more resistant to fibrinolysis. Consequences of thrombosis. Arterial thrombosis. Obstruction. Myocardial infarction due to coronary artery thrombosis. Cerebral infarction due to carotid artery thrombosis. Acute lower limb ischemia and infarction due to femoral or popliteal artery thrombosis. Embolization. Cardiac or aortic mural thrombi to emboli to brain, kidneys, spleen. Venous thrombosis, such as deep leg veins, obstruction, local congestion, swelling, pain, tenderness, edema and impaired venous drainage, infection and varicose ulcers, embolization, thrombi at or above the knee to pulmonary emboli. Embolism. Any intravascular mass, like solid, liquid or gas, carried by the blood to a site distant from point of origin. Most derived from thrombi. Lodge in vessels too small to permit further passage. Partial or complete vascular occlusion. Distal tissue ischemia and infarction. Pulmonary thromboembolism. Arise from thrombi in the systemic venous circulation. 95% in leg veins, pelvic veins, intracranial venous sinuses. Risk factors as for venous thrombosis. Effects are twofold. Possible infarction of lung tissue supplied by infarct. Interruption of oxygenation of blood within this area. Interruption of right ventricular outflow. Effects depend on size. Pulmonary thromboembolism. Embolus migrates from deep leg veins through the venous system to pulmonary circulation. Pulmonary thromboembolism. Small, silent due to collateral bronchial artery flow. The organization with cumulative damage. Medium, pulmonary infarct with acute respiratory and cardiac symptoms. Large, right heart failure and collapse. Massive, sudden death such as saddle embolus. Systemic thromboembolism. Arise in arterial system. Atheromatous plaque with thrombus. Valve vegetation. Atrial thrombus. Old myocardial infarct. Recent myocardial infarct. Rarely paradoxical embolus from the venous system. Systemic thromboembolism. Travel in systemic circulation. Cause arterial occlusion, distal ischemia and infarction. Brain. Stroke, neurological deficit or death. Renal or splenic infarcts may be asymptomatic, seen as ischemia scars at autopsy. Intestine. Mesenteric emboli cause an intestinal infarction, can be lethal. Limbs. Ischemia foot, like dry gangrene. Other forms of embolism. Fat embolism. Next most common after thromboembolic. Fracture of long bones or burns or trauma. Can cause severe pulmonary insufficiency. Air embolism. Gas bubbles obstructing vascular flow. Surgical or obstetric procedures or chest wall injury. Decompression sickness. Gases dissolve in blood at high pressure. Come out as bubbles during rapid decompression. N2 bubbles remain muscle, lungs, brain, heart. Non-thromboembolic, vascular insufficiency. Atheroma. MI, hypertension due to renal artery stenosis. Spasm. Angina, Raynaud's phenomenon. External compression. Surgery, torsion, tumor. Steele syndrome. Blood diverted to one organ or tissue due to increased demands, compromising the supply of another. Hyperviscosity. Sickle cell disease to splenic infarcts. Consequences of vascular insufficiency. The number of determining factors. Size of vessel and size of the vascular territory. Partial or total vascular occlusion. Duration of ischemia. Metabolic needs of tissue involved. Presence or absence of alternative circulation. Most important consequence equals infarction. Commonest cause of death in the Western world. Summary. Thrombosis. Normal hemostatic mechanisms. Pathogenesis. Virchow's triad. Arterial versus venous thrombi. Fate of thrombi. Embolism. Types of embolus. Systemic versus pulmonary embolism. Other causes of vascular insufficiency. Consequences of vascular insufficiency. That's it for now. I hope you like it. Thanks for watching, and don't forget to press subscribe button.